you.
Thank you. Ms. Herrera Beutler.
Thank you, Mr. Secretary, for being here. And I wanted to bring up just a quick follow-up on my colleague's question about Title 42 and rescinding that authority. And you made the point that it is a health-related decision. And I agree with you, which is one of the reasons I would ask you to help us get the administration to reconsider. You could do a quick Google search of the just drugs flowing in from Mexico. And fentanyl, which is a huge problem in Washington State and across this country, certainly on the West Coast. Every major newspaper has stories on how this drug, which is is killing people, and methamphetamine are flowing over that border. And we can almost tell. I've met with my local law enforcement in the middle. I am I-5, Canada to Mexico. I-5. They can tell within a week of a surge, drug prices for fentanyl dropped to $3 a pill. And we see increases in overdose deaths and hospitalizations. So I would argue that it is, in fact, a health crisis as well, which would give you the reason to use that Title 42 authority to gain some more control over the border. So I just wanted to put that in your wheelhouse.
Thank you.
And let me start by saying, Congresswoman Lucille Roy Ball-Allard made several really good points about, our efforts on infant care and maternity care. And you know that the numbers for the developed world, the U.S. is not where we should be on both of these fronts. So I do want to say I'm very grateful that you are working to implement an extension of Medicaid for women during that first, year of life. We know that most of the mortality incidences that happen within that first year, not within the first couple of weeks or 6 weeks of giving birth, but most of them happen after that. So making sure that Medicaid coverage extends to that first year of life of the baby and the mother to treat that is incredibly important. We have legislation to that effect, but I'm glad to see that the administration is moving forward with that. On the FY22 omnibus package, Lucille and I were able to secure $750,000 for the first ever stillbirth task force at HHS. More than 22,000 babies are stillborn every year in the United States, one of the worst stillbirth rates in the developed world. Where is HHS in the process of setting up that task force, and how can we utilize existing programs like the Safe Motherhood Initiative to optimize the work of this task force?
Congresswoman, first, thank you for all the work that you and Congresswoman Roy Ball-Allard have been doing on these subjects. Small investments, big change. And we're going to work with you on that. Thank you for making it possible. We're going to get to work as quickly as we can on some of these things. I can't tell you how many stories my wife has told me about stillbirths as an OBGYN. That's as devastating as it gets. And so we will do everything we can. We will include you, and we're going to try to make sure everyone understands that we have an opportunity now to really shine a light on this and focus a bit more.
Great, thank you. Switching a little bit to telehealth, one of the silver linings, I think, if there is that of the pandemic, was that we recognized that we can do telehealth and do it well. The biggest challenge, and for those of us in more rural areas, it has been a godsend. The biggest challenge I've heard is it's been great that CMS, there were waivers in place to pay for it. Will those be extended? And I know that there's a little bit, it's not totally within your purview, but I'd like to hear you for a moment just share what your intentions are with regard to trying to help us make that more permanent.
Well, first, I have to thank you all for giving us the extension of another 5 months of the authorities on telehealth under this public health emergency. We need more help because we only have certain authorities to continue some of the telehealth activities that we've engaged with. And we're hearing from all sorts of providers and families about what happens if they can't use telehealth. So we're going to do what we can. We're going to stretch our authority as much as we can under law, but we do need Congress's help because the statutes constrain how much we can use telehealth. So please help us with that. Thank you for the 5-month extension.
In my area, it's switching to workforce shortages, and very quickly, obviously, we don't have enough of anything. Right? We don't have enough RNs. We don't have what we need. Again, this is another piece where telehealth can help. But your budget proposes a $2.1 billion increase in the HRSA workforce programs. How can we ensure that we're focusing on the entire workforce pipeline? And how can we do this in the most expeditious manner possible?
Well, we have specifically targeted rural health, as well as some of the underserved areas. For a quick example, on telehealth, you could have someone who wants to do telehealth as a provider, as a doctor, but if you don't have good broadband, there's a really strong chance you're still not going to be able to take advantage of that. So the investments in broadband that now have been made available, the fact that we're trying to figure out how we allow that service to cross state lines as well, because there are different standards in different states for those medical professionals. But we, not to let the old way of doing business get in the way, we're going to try to do all of that. But that's where we'll need your help to give us the authorities to go beyond what we've done before.
Oh, thank you. Thanks. I yield back, Madam Chair.
Congresswoman Clark.
Thank you, Chairwoman, and it is so wonderful